Let's talk about the big pharma reading. What were some significant claims here?
8 out of 9 of the leaders of doctors who decided the general rulings regarding prescription medication were funded by pharmaceutical companies.
That is significant, isn't it? 8 out of 9 of the doctors who wrote those guidelines were in receipt of money from statin manufacturers. Yeah, and the one guy who actually really pushed it. So you guys don't have to say if that's something you were diagnosed with, but you probably know a lot of people that were diagnosed as having ADHD. What are the symptoms?
Inattention.
So inability to pay attention. Yeah.
Like educational delays.
Sure. And that's like the end result probably, because not being able to pay attention, having a lot of energy and, bouncing around, you're not able to focus on the thing that you're supposed to be focusing on. I mean, you're a kid and you're sat in a classroom and you're supposed to be quiet and listen to someone drone on, yeah? Does that work well for any kids? Let's see here. ADHD. Trouble focusing, attention on a single task for longer periods of time. Yeah, that's pretty much what you said, Ollie. Isn't that every kid, though? Remember, what I'm not saying is that ADHD is not real. What I am saying is, do you think it might be hard to diagnose it in children when, that sounds like a normal kid to me. So when you diagnose a kid with that, some of this issue could have to do with money. How do you make money as a doctor?
Funding.
Well, different types of doctors. So like a doctor that treats patients, let's say you go to school first. How much schooling is involved?
12 years.
Could be 8 to 12 years, right? A lot of people do go for like 12 years because we're not robots and it's really difficult. Is that generally expensive schooling? Yeah, like the programs that you need to get into are typically needing to be at some pretty costly schools. By the time you get out, by the time you actually have your degree, unless you're already from a rich family, the chances of you having debt, like a good amount of debt, are pretty high. So you go to school, you come out, you're like, I'm going to be a doctor and make money, because some people, right, first, you want to help people. That's what you really want to do as a child. You're like, that's why I want to become a doctor. And so you go to become a doctor, but now you've got a bunch of debt. And do you make money right away as a doctor?
No.
No. What kind of things do you have to do to start with work?
I forgot what it's called. Residency
at a hospital or something. You end up working for a hospital. There's a lot of money you have to shell out to own your own practice. The overhead and everything like that. Most people who become doctors end up not paying off their student debts until they're in their 50s at least. So think about that. You think doctors make a lot of money, but unless they take pharmaceutical money, and you got to think with how those pharmaceutical reps come in daily and even feeding your table staff. I don't know if any of you guys do this or if you know people who've done it, but I've had several students who actually worked in hospitals or in doctors' offices, and they said that, yeah, they eat really well. And in fact, it's part of hiring. Like it's a perk of the job. So yeah, you'll get paid this much, but also you get to eat well and for free every day. Like meals are taken care of. That is a significant thing. So even though it seems like really silly, like what? How could a doctor be bought off by getting fed just one meal a day? It's like, well, it's not just them, it's their entire table staff. It's their entire office. And then there's a little bit of pressure going on there because they can even check what doctors are prescribing. Oh, we noticed you're not prescribing our pharmaceuticals, you're prescribing our competition's pharmaceuticals. That's interesting. Maybe you don't want to eat lobster for lunch anymore, or whatever other things they might be handing them. You guys saw how manipulative that was, like the idea of thought leaders in the medical community, and then they're really just peddling, almost looks like a pyramid scheme, but it's not. It's worse. It's not worse, it's just a different evil. So that was a big point there. All those doctors were getting paid. So that points to a significant thing about how much money pharmaceutical industry puts into marketing their products. I wonder if they're putting as much money into the actual studies of what their products do. And sometimes their products, they just stumble upon what they can do and then they use it for that thing, like Viagra. What was Viagra originally supposed to be for? Does anyone know?
Vasodilator.
Yeah, so for your heart, it was supposed to be a heart medication. So it's interesting that they figure out, oh, it actually does something else. It focuses on this other thing. So then it's marketed for that. Yeah, so it's interesting how that stuff comes about, and then the testing, right? And how long should you be testing this kind of stuff?
Quick question regarding the sources. Like, I chose like the 3 biggest sources to validate. Is that like the correct way to do this reading response?
Which ones did you look at?
I looked at America is the most medicated nation on earth, yet we have the worst health outcomes.
Okay, so this one was tricky, wasn't it? Let's go back and talk about this for a second. So let's open that up, open that one up.
I don't think it's a fair assessment to say that it's the most medicated, yet it does.
Why would you say that?
Because if you look at it, the most prescribed drug is for like chronic conditions like heart disease and diabetes, which are already pre-existing, right there. Often when people talk about health conditions, they're talking about chronic illness. So the second most is for antidepressants.
There we go, which is what you were really thinking about. So when you read 70%
Right.
of Americans,
She wanted me to think about, we're medicated, so we're high. But after looking at it, it's obviously...
I thought that too. I was like, oh, wow, 70%? That's a crazy number. And then you look at it, you're like, wait, hold on, let me look at this. And so in that case, yeah, that's significant. Antibiotics are also in there, aren't they?
Right.
Also, what I would have done with this too, I would have gone further. Look, they hyperlinked researchers from Mayo Clinic. If you do this properly, like in the future, like you guys really want to, well, come on, CBS News, they're also journalists too. So you want to go and find the other source, and then you start seeing, oh, wait a second. And this is a little bit older. So you'd also maybe want to see what newer research, because 7 years old, that's if you want to carry that out a little bit further. But Mayo Clinic, which is a good source. So over here, comparison. Now, then we really have to go back and look at her claim itself. And so this is actually what a lot of students get hung up on. They looked at that number and they kind of got confused about what she's actually claiming. That's what I did. The first time I read this, I was like, wait, what? Where's she going with this? This is all still just setup though. Think about it. She's just talking about how is it that America takes the most medications in general, and yet we have the worst health outcomes. And so in light of that claim, I can agree with you that it sounds a little bit misleading, but you're supposed to take those two sources hand in hand in the respect that she's claiming, look at how many drugs we take just in general, and yet somehow we're so unhealthy. We're like the most unhealthy developed country there is, and yet somehow we take all these drugs for our stuff. What is going on with us? And so she's not quite to the point of what we really care about with the pharmaceutical argument, but you're right. It does sound like she's already going there up front with that 70%, but her claim is still not as extensive as it sounded like it was if we really look at it again. So that's really important to notice. So fair use, but a little harder to figure out what she was doing with it. But that all makes sense now, right? We do take a lot of drugs.
Right.
Like
the point was that we take a lot of drugs. So it's significant because there's drugs in every household. So
yeah. Now, did anyone check out the next article? Fraud in clinical drug trials? There's another one by this guy too. Falsified studies.
Isn't that where they find like loopholes to get FDA accepted?
Yeah, exactly. So check this guy out. Now, who is this guy? Who is Charles Seafy? Did anyone look to try and figure out who he is? This gives you a little indication. The FDA buries evidence of fraud in medical trials. My students and I dug it up.
That person is a professor?
He is. He's a professor at which school? I think it's NYU, and he's a journalism professor. So he's teaching kids how to do journalism. So he's literally like enlisting all of his students into actually examining this FDA evidence, and he's able to dig up all this stuff. Some people might say that's unfair because they're not getting paid, but they are getting paid, right? This is part of your education. It's practically going and doing the thing. So he's got an army to work with. He went over like 600 studies or something. It was just like a crazy amount of things to go through. No one person would be able to do this in a reasonable amount of time. Well, a reasonable amount of time would be like years to examine these records, but he was able to get people to help him. There's some pretty frightening stuff in here. What did he say? So faked x-ray reports, forged retinal scans, phony lab tests, secretly amputated limbs. What the hell? Did anyone click on that? They're like, show me. I want to see the evidence of that. So is this fair? Does this look like a legit source? This is a legit source, just so you know. Okay. So US Food and Drug, remember, it's a FDA.gov. I know professors have told you .gov means that it's trustworthy, but you also need to remember that the FDA has also lied. You have to read in between the lines for everything you're looking at, right? And think about, well, what's the motivation of admitting to something? Or the motivation for this organization, the FDA or the USDA or all the different government organizations that are supposed to be responsible for certain things. They also don't want to look bad and they don't want to get in trouble themselves. And so you're still having to take things as there's always going to be bias, even with the government stuff. At this point, you really shouldn't trust any of them further than just no one blindly. I think I made that point. I apologize, there wasn't enough examples of what I was talking about, a lot of abstract ideas in that first video today. I apologize for that, but it's just a lot to think about or a lot to really express. And it would have probably ended up being like a 2-hour video if I would have walked you through examples of everything I was saying. But I think we kind of already cover examples of that stuff as we go through even things like this. So yeah. What else was significant? Think about not just the significant claims, but then what about the consequences of those if they're true, which most of the things she says here, they're true things, right? There's something else that I find significant. If you guys go to the second page, so did you guys notice what's the significant thing going on here? Every year, 800,000, I guess, scientific articles are written, like peer-reviewed ones. How do doctors stay up to date, like current with stuff? Like let's say someone got their MD 40 years ago. Have there been a lot of advancements in medicine? Oh yes, so many. How do they stay up to date?
Reading?
Yeah, they have to read medical journals like all the time, or they're supposed to. How do you keep up with that? Have you guys even been to a doctor's appointment like in the past year or so? You know what they're like now? They're like budgeted 15-minute things. It's crazy. Can you get enough done in 15 minutes? Like doctors are spread so thin now. If they are working for a hospital, at the very least, they're being pushed to do every possible thing they can. They're worked for the whatever money they get. It's a pretty demanding job. And on top of that, for them to have to stay up to date with medical journals and things that are happening there, with how much is coming out, it kind of seems impossible, doesn't it? Well, so let me ask you a question. What we really are talking about most of the time when we think about big pharma is either opioids or medications for the mind. That's what we're pretty much thinking about, at least for the most part there. Who is prescribing those? Do you guys know? So there's different kinds of doctors, right? I don't wear a wedding ring because I got this thing. There was like a cyst on my hand right there. Do you see that scar? So I got it from wearing my wedding ring while working out and doing maintenance. I used to do a maintenance job at all kinds of stuff. And my wedding ring was tungsten carbide, so it never got scratched. So I could just wear it while I did anything. But then it actually made it so like I got this weird thing under here. And then I couldn't wear it at all. And then finally I got surgery on it. Now I went to my normal doctor and he says, oh yeah, I've done surgery on that kind of thing before. No, I can't do that for you. You need a hand specialist Is anyone aware? How many types of doctors can you think of off the top of your head? There are specialists for like everything, even the hand, right? My doctor has actually done surgeries to remove that stuff, and yet he wouldn't do it because it was on my hand. So there's a hand doctor, there's a foot doctor, there's a cardiologist. Do you guys see where I'm going here? Any other ones that you can think of? A spinal surgeon.
A urologist.
Urologist, since we were talking about.
Nephrologist.
Yes, exactly. Podiatrist, any of those, right? So you've got different doctors who do different things, yes? To the point where you need to go to that specialist for them to perform that procedure because your doctor isn't qualified for it. Okay. Is your general practitioner qualified specifically in the mind? What's that kind of doctor called?
Psychologist.
Psychologists focus on the mind, but they're not allowed to prescribe medications. Who's allowed to prescribe medications for that?
Psychiatrist?
Psychiatrist, right? That's the only difference between the two. One's allowed to prescribe medications and one's not. So that's the thing though. Your normal doctor can also prescribe medications for that too. Yes or no?
Yes.
If you ask your doctor about one of those things, they can prescribe it for you. You don't have to go to a psychiatrist for that. But that's not their specialty. How do they know about that stuff? Is it because they read a brochure and because the pharmaceutical rep told them about it? Remember about those pharmaceutical reps? Do they have degrees or experience in the medical field where they should be authorities on the matter? Was anyone frightened by that? If they're just listening to them and they're taking the pharmaceutical company's word for it on what that thing is supposed to do, that's a problem. But maybe doctors understand that, like my doctor who's like, hey, I'm not even going to touch your hand because that's not my field. Maybe they are sending their patients to the psychiatrist who is trained in that. That is their field. Do we have numbers on that? Do you guys know what percentage of mental illness medications or medications for the mind, antidepressants, any of that stuff, what percentage of those are prescribed by psychiatrists as opposed to just your general practitioner, your general doctor? So I pulled up this study. I just screenshotted it, but that's the website right there. And then this is the medical journal that it's in. So here's the quote, just in the abstract. So they're working with numbers. 80% of these prescriptions are being prescribed by general practitioners. 80%, not psychiatrists, general practitioners who don't have their degree in it, who didn't study for this. Here, this is a different one that you could look up if you're interested. So between 1996 and 2007, the proportion of visits at which antidepressants were prescribed by no psychiatric diagnoses were noted increased from 59, so roughly 60%, to 72.7% by general practitioners, like without a psychiatrist interviewing them and talking to them. Is that crazy? Look at who's prescribing these. So is there a problem with that? What I want to ask you guys, because this is a frightening thing. We're going to do a free write really quick. And so I want you guys to, like, in 5 minutes, just write down your ideas on these things, and then we will talk about what you have to say about them. Okay, try and wrap it up. If anyone wants to start, what is at the root of mental illnesses? How do we get them? Are they nature or nurture? Like, is it something we're born with that we're going to get anyway, or is it something that develops over time because of our environment?
I think it's a little bit of both.
Okay.
So nature, it could be due to genetics. One of your parents has some type of mental illness. You're probably bound to have something like that later on, or
What are you thinking about?
Either schizophrenia. So that's for nature. For nurture, it could be kind of like your environment, maybe abusive environment or stressful. A lot of mental illnesses can come out of that due to the environment not being too positive or something that's good for the individual.
Right. Look what you're doing. That was good. Remember the ways to respond? Agree, disagree, or both? You did both, which tends to be better. If you're fully in agreement or disagreement with whatever someone is saying, chances are you are misunderstanding them. You're doing this right. Yeah, there's a lot going on there. But let's flesh that out a little bit more too. What does anyone else have anything to add to that?
I agree with Stephanie that it's both of them. However, I think that it's more something called nurture than nature. Like, person has depression, but that person doesn't like pay attention to it or doesn't mind it, take care of depression, and it gets worse, or even anxiety or like Stephanie said, schizophrenia. In that case, I believe it's more of a matter of nurture.
So that's the thing, right? It depends on the mental illness that we're talking about. Now, when we talk about, let's say, I wasn't even going to go into this, but it is important to talk about. So you bring up a perfect example, Stephanie, of an illness that can be hereditary. If a mother or someone in the past has schizophrenia, there is a higher chance that you will have it. Now, we don't know why necessarily yet because there's so many variables to work with there, but we do know that there is a correlation. That does not mean causation, right? That would be a fallacy if we just jump to that conclusion, but there's something going on. And there's also something unique with schizophrenia that does address the second question I asked about diagnosing things too young, because when does schizophrenia normally show up? Does anyone know?
20s.
In your mid to late 20s. So that's interesting. So obviously no one's going to be diagnosing that earlier. I mean, there's some extreme cases where it just shows up really early, but that is interesting. The other thing that is interesting is, have any of you guys heard of synaptic pruning? Do you know what that is? Here's some images, but what happens when you are roughly around the ages of like 2 to 4. So let's say in a 1-year-old's brain, they have more connections than adults have. So imagine you have come into this world and your brain, you are trying to grasp and figure out what is going on. Your brain is trying to do so much when you first start in life. So it's making all these connections to operate. But what it starts doing is it starts finding connections like you see in this picture, right? That these connections are, there's too many. Like maybe you have a straighter shot to get there. And so it starts pruning and cutting away connections between the ages of 2 to 4 of things that you can get there faster, or you don't really make that connection anymore because it didn't profit in some way. So it's removing unnecessary connections. Does that make sense? And everyone's brain goes through it during that very important time period of life. So it makes it more streamlined and more useful. Now, this is a thing. There is a direct relationship between synaptic pruning and schizophrenia and autism. So this is really interesting. Autism. You guys know what it looks like. Generally, there's a spectrum of it, but a lot of what's going on is there's a sensory overload. There's too much going on. So the brain is having a difficult time being able to interpret and then relay and be able to operate in the situation. So with autism, they're finding that there's not enough synaptic pruning that happens. So they have too many connections in their brain as opposed to people who have less. They're able to figure something out without all this stuff bombarding, and they're able to come to those conclusions and to be able to operate in the situation and shut things out or whatever much more easily. Okay? Schizophrenia is actually connected to having too much synaptic pruning. And that's really interesting. I think you could go and you can look further into that. I think that's what scientists are doing right now, but it is interesting to see that that is actually a factor involved in the physiology of the person who is dealing with those issues. So that's obviously a nature thing though, right? You can't do anything about that once it's done. It also points to the fact that there is definitely a nature component to those things that we can't do anything about. So when we talk about depression, which is where Jose was going, yeah, that is something to think about. So do you guys know what the DSM-5 is, or 4 or 3? This is the manual put together, the manual for diagnosing mental illness or conditions, disorders, any of that stuff. So it's like the Bible. Or see, that's the thing. The guy who was the chair of the DSM-4, which was the previous version of it, he says that there's a problem with the DSM-5, which is what they've been using for pretty much the last 5 years. So he says it shouldn't be looked to as a Bible, because when you think about the Bible, you think about it religiously and something you follow with faith. And he would argue that you should be using less faith with it and more of just looking at it as this could be it. See, the problem is in how they diagnose things in it, or the descriptors for illnesses. And if you see up here, there's new disorders that have been added to the DSM-5. Things that maybe you have heard of in the past couple of years that have come out as disorders, like binge eating disorder, caffeine withdrawal, cannabis withdrawal, disinhibited social engagement disorder, hoarding disorder, video game addiction. Here's one, narcissistic personality disorder. So symptoms of narcissistic personality disorder: excessive need for admiration, disregard for others' feelings, an inability to handle any criticism, and a sense of entitlement. Yeah? Did I just describe to you like a 5-year-old child? What if we went and, so think about what a sociopath is, or a psychopath, or a narcissist. Think about those and imagine if you tried to diagnose a child, like a very young child, with that stuff. There's a possibility that a high majority of children would pass the test with flying colors for being sociopaths or for being narcissists. And it's interesting. How do you become a narcissist? Is that something that is nature, or is that something that is nurtured? Even according to scientists, what do you think? Like, according to psychologists, what do you think they would say is the cause of that?
Trauma.
Trauma, okay, which is after being born. It's part of the nurture process, isn't it? It's something that you were taught, or you coped with trauma by becoming like this. Yeah? Does that make sense? So there's a lot of them that are like that they are something that was learned over time. And do they prescribe medications for these? Maybe not narcissistic personality disorder, but what about depression?
Yes.
There is something to say for depression. It's really important to understand that I am not telling you that people should not take prescription drugs for mental illnesses. I am not saying that. What I do want to call into question is why we use them and how we use them and what is happening in the brain. So, anyone here ever been depressed? I get depressed a lot. There's a lot of things to be depressed over, especially right now. You guys understand how if you don't get depressed over what is happening right now, then there is probably something wrong with you. There are normal things to be depressed over. It's a natural thing that occurs, that should occur when something is going bad. And yet, there are also forms of depression that happen when there's nothing to be depressed over. And so I'm saying there are forms of depression that might be chemical, but then what is the answer with how to deal with that? Okay, name some brain chemicals for me. How about that? Can anyone think of some that you learned?
Dopamine.
Dopamine. What does dopamine do?
Reward system.
It's a reward system. Yes. So when you do something good, like for your body, that your body is like in approval of, it will release dopamine. What's another one?
Serotonin.
Serotonin. And what's that one do for you?
Stress. Or that's cortisol. I forgot what serotonin is.
That's good though. Cortisol, which is useful. You're like, what? How does stress help me in any way, but epinephrine and norepinephrine, which are
Adrenaline.
yeah, adrenaline, which fight or flight. So you need that stuff. Now, the world works weird now, though, doesn't it? Here's your brain on natural brain drugs. Or maybe that was LSD. I don't know. So we talk about adrenaline, these different components of the cortisol system. Dopamine, serotonin, endorphins. That's one that you get from working out. So you do things and your body gives you things for that. What's the love brain chemical? Does anyone know? You don't remember? Wasn't it in the video? Oxytocin? When you get a hug, or when, especially in childbirth, when a baby is born, the mother's system is flooded with oxytocin. It's just this high practically. So these are some of the ways that it looks, right? You've got receptors, these are all neurotransmitters, right? You know, they flood in and then you've got an uptake. All right, so with dopamine, you get it for a lot of different things. You have a baseline, you get it for food. So percentages, if your baseline is 100%, how much do you get for food? Where does that level get raised to when you eat food? Something that you needed. You were hungry, so you ate. How much do you get roughly, do you think? Okay, I'll start you off. 150. So you go from 100 to 150%. You get dopamine from eating food. What about video games? So you get some other things too while you're doing video games, like adrenaline, right? Because you're visualizing, you're putting yourself there like it's really happening, depending on the video game you're playing, right? Maybe it's a racing game, maybe it's a sniping and you're shooting people game, maybe it's like Resident Evil where there's like zombies and, you know, weird things jumping out at you. What do you think you get for that?
200.
Well, like 175, but it could. I think when you're playing like the really intense ones and you're just like really going at it, yeah, you could definitely get up there, especially when you accomplish something with it. What about sex? What do you think sex gets you?
3,000.
No, sex gets you about 200.
Okay.
What about cocaine?
3,000.
You're going way too high, man. Come on.
I'm just waiting for I'm waiting for the curveball. Is it just going up gradually? Is what I'm saying?
Yeah, it is. It's going up gradually, dude. Yeah, come on. Cocaine can't be that much better than sex, all right? And remember, this is just one component of it. Like, you know, weed doesn't give you any dopamine. Did you know that? It's giving you something. It's just not dopamine.
Right.
So yeah, cocaine gets you 450. You feel really good on cocaine. And then, yes, there's the possibility of mixing things, right? You can eat while doing cocaine, while having sex, and playing video games all at the same time. I'm sure someone's done that before. What about heroin?
That actually gives you dopamine?
Yeah, you get dopamine from heroin for sure. What do you think?
1,000.
Actually, it's roughly around the same amount as cocaine, but it's also doing some other stuff too. The one that I was shocked by was meth. Because heroin, you look at heroin as being like this really intense drug, feel-good thing. I think that's a little high for cocaine, actually. I don't know about this chart, but like for meth, yeah, meth, it gets you, like you jump from like heroin and cocaine being at like 400, 450 to like 1,300. Like you can see why people like when they do meth and get addicted, it's like, it's freaking gnarly. So that's the main thing that you're getting with meth. With heroin, you're getting other stuff too, but like meth is just straight dopamine and it is so incredibly addictive. Now, can you imagine trying to live life without meth after you've been addicted to it? All the brain chemicals, right? Like things are just getting you to brain chemicals. And what happens when you find a cheat to it? Because you get dopamine from likes. You get dopamine from watching videos, from getting attention from people. All that stuff, it gives you that reward, and it's a cheap way to it too. So instead of doing something for yourself that you need, like getting sleep, working out, have you noticed there's like a much higher problem with like adrenal fatigue now, where people have extremely high cortisol levels and they end up having issues that come out from it. Someone who's close to me, they get benign tumors in their abdomen that get to the size of softballs because of their cortisol levels. Like there's crazy things that can happen to you from having excessive or incorrect levels of these neurotransmitters. They're powerful. And then our cravings for them make us do things that end up giving us this and something else. Like meth also deteriorates your bone and flesh, right? So you've seen tweakers, right? You've seen people who are like super skinny from meth, but it also makes their bones brittle. Like your teeth fall out of your head. That's fun. You get a whole bunch of zits and then you pick at them because you can't not. There's so much going on with that. All that to say, there are ways that you can change your life to change your levels of these, right? These things do good things for you in the right balances. So I guess what I'm getting to with that is think about it. Is the answer to give pharmaceutical drugs? Because you could have a magnesium deficiency, which causes you to be depressed. So why not take magnesium? Why take something that a company owns, a copyright on this drug, like you have to get it from them? Have you known people who have gone to psychiatrists and they prescribed for them to start taking something that was natural over the pharmaceutical drug, or does the pharmaceutical drug get pushed above everything else? It's interesting. It doesn't mean that those are bad, but there's something going on. What does an antidepressant do for you? Do you know anyone who takes them and how it makes them feel? What do some of those things do? We're not even talking about side effects here. Like some antidepressant side effects are severe depression with thoughts of suicide. Like sometimes that happens. Like you take something to be an antidepressant and it goes even more extreme. We're not talking about that. For what it's supposed to do, what is it doing? Is it typically more of a numbing thing? There's definitely a problem. Maybe the way that we diagnose them. If something is a disease, like alcoholism, if that's a disease, does that take away your responsibility for handling it a bit? Kind of makes it so you're not obligated. Hey, it's a disease. I can't control it. That's the connotation. That's at least the argument that I've heard from a lot of people. So that doesn't mean that it's not a real thing, but depending on how we look at it and depending on how we try to take care of it, the things that we do to change our behaviors or to operate around the issue that we're dealing with can make a huge difference. And if we go so far as just saying it's a straight up disease or a straight up like this is an illness that I have no power over, when in fact that illness happened because you were nurtured that way, depending on the illness, right? If it's something like narcissism that was built into you through mimicking and through reacting to the ways that you were brought up and how you've fed off of the dopamine that you got from attention, is the answer to take drugs or to change your behavior, to understand what you're doing and to change it and to make new pathways in your brain so that you don't stay that way? That's just something to think about. If you look at these questions here, some of these you could actually turn into a claim. Like you could make it into a claim of fact. Remember how with a thesis, it could be answering a question. So take the question and turn it into an answer that you're making a claim about, an argument of fact that could be so simple as we are diagnosing mental illness too young. Boom, that could be a thesis statement. I'm not saying that that's the one that you should pick. You probably don't want to do that. It might be too difficult for you to do, or maybe you don't agree with that. We aren't diagnosing mental illness young enough. We should be going younger. And depending, you could qualify it. Well, we're talking about these types of mental illness and not these other ones. And then that means you've got a good, solid, specific argument that you can really develop within 5 pages. So yeah, there's a lot of other stuff, right? Like if someone has a true chemical imbalance in their brain, this is a TED Talk where this guy, he's a psychiatrist, and he went over 83,000 brain scans. So you can actually tell if someone has a chemical imbalance by doing brain scans. You can see it in the brain scans. Do psychiatrists take brain scans for everyone that they diagnose and then treat? You're giving someone antipsychotics, but you haven't even given them brain scans. See, that's a problem. When you can actually tell, it's not just like a guessing game where you're like, I'm just going to prescribe this and we'll just see what happens. We'll just see what happens, even though this stuff is freaking hardcore. Like you're giving someone hardcore drugs. So think about that. If something isn't a chemical imbalance, then why are you prescribing a drug? Shouldn't there be more of like a working through issues with you? Some of the stuff, a lot of things with addiction, which then we diagnose as a disease, the issues have to do with human relationships that we're not getting. We're not getting something out of the human relationships that we have. And so we go to drugs instead because it's an easy way to the chemicals that we end up lacking from those relationships.